Good morning. My name is Brian Sekaja. I work with Reproductive Health Uganda, and I would like to talk about the impact of the COVID-19 prevention measures on the lives of young people living with HIV in my country, Uganda. Uganda, for those of us who have not yet known, had one of the world's longest COVID-19 lockdowns, with measures like school closures, curfews, self-isolation, banning of public transportation, and public gatherings in place. Schools in particular were fully or partially locked and shut down for more than 83 weeks, which affected over 2 million in and out of school young people, including young people living with HIV. But for particularly young people living with HIV, these prevention measures appear to have had a lot of impact on their lives, especially when it came to accessing HIV prevention information and services. Therefore, after realizing this, Reproductive Health Uganda, with the Sexual Reproductive Health and Rights Alliance in Uganda, with support from Rutgers, decided to conduct a mixed method study to assess the impact of these measures on the lives of young people across the country. This targeted, we wanted to study about young people's mental health, mental well-being, their livelihoods, access to sexual reproductive health and rights information and services, and gender-based violence. My presentation in particular will focus on the data that was collected among young people living with HIV. The study used a mobile web survey that was conducted by Geopol across the country. This targeted approximately 640 young people, majority of whom were male and were between the ages of 18 to 30 years. We also had youth-led focus group discussions with young people between the ages of 15 to 24. We targeted 4 groups, including young people living with HIV, young LGBTQI, teenage mothers, and young people in school. More to the survey, like I said earlier, it had approximately 640 respondents, all of whom were between the ages of 18 to 30 years, and had either completed some level of education in college or university. This was so because the study in particular for the survey required that a person had access to a smartphone, and a smartphone that could access internet. And most of the young people who have these smartphones and can access internet are people in this level of education. Some young people, some respondents reported having a disability, and majority of them were either single and currently dating. Now, the revelations of the study revealed that there was a tremendous need for STI and HIV testing and treatment services during the pandemic. Most of the young people reported that they needed information on sex, pleasure, and COVID-19. Some needed information on STIs and HIV treatment and testing. Young people also reported that they lacked access to medication, and all those who needed these services, 55% of them could not access the services because of the COVID-19 pandemic. The reasons why these young people were not able to access these services, or they found difficulties in accessing these difficulties, because they were afraid of catching the COVID-19 virus. As you know, the COVID-19 virus came along with its own stigmas. Now, if added along with the HIV stigma, young people feared to have double stigma. There was also a report of lack of transport, as public transportation in Uganda was banned and locked down. Health facilities were closed down as a result of the fear to spread the COVID-19 pandemic. We had 5 p.m. and 6 a.m. curfews, which hindered young people's movements to the health facilities and other places. But also, young people reported stock out of medicines as a reason as to why they were not able to access their medication. Young people were also unable to meet their support groups, the young people living with HIV. They had to put their medication on hold. They were unable to do viral load testing because the health facilities were closed. And this increased chances of experiencing stigma, the pandemic. It also hindered access to contraception to the young people, including condoms. Now, surprisingly, young people experienced or reported a lot of experiences, but one I would like to focus on is that some of them reported that the pandemic was a blessing in disguise, as you can see on experience number 3, one young person said that being home for this long time had helped them to adhere to their drugs and to take the drugs in time without fearing stigma. This is because when they were in school, when their school were still open, some young people had to hide in toilets, behind the classrooms, so that their colleagues in school do not see them taking their medication. Besides the young people living with HIV, we also interacted with other groups of young people, including young people in school who reported that the pandemic increased their vulnerabilities due to lack of access to sexuality education. Just to note that in Uganda, there is currently a ban on sexuality education, and most of the young people that we have, especially those in school, the only opportunity they have to access this information is when they are in school. Like NGOs and individuals or people have to access them through school. Sex workers also reported an increase in physical and psychological abuse. LGBTQI reported increased harassment, rights violation, and economic hardships. The teenage mothers we interfaced with reported increased economic hardships due to the fact that most of the businesses they had to operate were closed down due to the pandemic. In the end, the young people recommended that HIV prevention, care, and treatment services should remain crucial during all times, including in case of pandemics. They recommended that we prioritize the mental health of young people living with HIV. We combat stigma, address stockouts, ensure access to PrEP and PEP, integrate sexuality education in online learning, because this is the only way of learning that young people had, and provide economic support for young people, including those living with HIV. Thank you so much.